There's no home. This is where I'm going. There's no chance I'll go to assisted living either. I'm getting worse, not better. I was in a place where I improved all the time, but I didn't move to the next step, which would be able to get myself up and grab the rail. Like I walked 50 feet, I walked 100, I walked 200. It's no good from a PT point.
When you evaluate someone, you say, I think they're going to go to this end point. And sometimes they achieve it quickly, and sometimes they achieve it slowly. But it's always trying to move in that direction. It's always, what kind of intervention can I put in place that is going to get this patient to that end point? You know, not every device, every technology is good for everybody. So you can have these computerized legs that someone your age or my age might benefit from, but somebody in their 80s, the technology is going to be way beyond them, and they're not going to be able to benefit. The Bioness is not something that everyone can use. If you have someone who's paralyzed from a nerve injury, they're not going to be able to use the Bioness, but if they're paralyzed from a stroke, they can. And that can make a significant difference in their ability to open and close their hand, in their ability to pull their foot up. Not necessarily always true. You can have someone in their 80s that's very active. So it's really looking at the person's overall fitness level, their overall cognition, their motivation, and using the technology to their advantage.
If you look at the market right now, the institutional market, the assisted living facilities, the nursing home and the hospitals, one of the primary reasons that people over there suffer from MSD, which is the musculoskeletal disorder, is because they try to lift patients. Right, so that's where our technology is, the 6-ball linkage technology. It was a perfect confluence of physical therapy and the mechanical engineering.
The walker is going to be good for a certain targeted population. Not everyone's going to be able to use that walker to their advantage or use it well. But for the population that can use it, it can be very significant for them.
Better.